Welcome back to Cancer Buzz. On today's show, ways to make your oncology practice more inclusive for sexual and gender minority patients. Sexual and gender minority patients experience health disparities that can impact access to screenings and treatments and can have worse outcomes as a result. Rosemary Thomas is the Director of Operations at Penn Medicine Center for Health Equity and the Associate Director at the Penn Med Program for LGBTQ Health.
We know that there's a large burden of cancer among the general population. And, among LGBTQ folks, we know that even though they are a small segment of our community, that there is an even higher burden because of delays in screening, delays in accessing care. So an intentional effort by oncologists and in oncology to reach this community and make practices more welcoming and kind of advance the science around LGBTQ care and oncology is needed to really impact the disparities. If we get people in earlier for screening and treatment, then we impact outcomes, and that can make a real big difference in a, small but important part of our society.
What are some of the issues that sexual and gender minority patients may experience that contribute to disparities in their healthcare?
It's as basic as not being addressed respectfully by the name that you use when you come in, when you call to make an appointment. That can really put people off from even coming in for the care they need. So if you call and there's no way for folks to capture the name you use and no one calls you the name that you use, you may never come back. And that can contribute to poor health outcomes because you're not getting care that you need in a timely manner, and then thus health disparities. Also, the kind of lack of knowledge will go back to that maybe in particular in cancer care, if I was someone who was assigned female at birth and retained my cervix, but affirm my gender as masculine or male, and I present masculine or male, and my provider doesn't think or have a way to talk to me about my gender identity or capture that anyway, maybe they'll miss this screening procedure for cervical cancer that I won't get a pap smear, or maybe I'm too scared to talk about that with my provider, so I will never disclose it.
Can you talk about the importance of capturing their preferred gender identity? And then how do you do that with every single patient?
From our experience at Penn Medicine, that there's a lot of sensitivity around asking around sexual orientation and gender identity data from providers, that they worry it's too invasive, that patients are going to be upset, that patients who maybe don't identify as LGBTQ+ will be very upset. But that's not borne out in the literature at all. In particular, there was a study in an emergency department where they surveyed staff in the emergency department and asked, do you anticipate patients will be uncomfortable or upset around asking these questions? And some 40% of staff said, yes, patients will be very upset. And then they surveyed patients in the same emergency department, and the patients, and only like 12% of the patients said are uncomfortable. So there's a real difference in perceptions between what providers feel patients will think about these questions, but patients want to answer these questions. They want to give the fullest picture of who they are so we can provide the best care.
How can oncology practices incorporate these questions into their everyday patient and provider routines?
So you need to embed it in all your workflows and systems that you do. There is guidance around the way to ask the question and the categories of questions. When we ask about gender identity, it should always be a two-step question where we ask, what is your sex assigned at birth? And then follow that up with, how do you identify your current gender? Or just, what is your gender? And then there's a set of options. And then for sexual orientation, can you provide information about your sexual orientation? So those are embedded. If you are an Epic customer as a healthcare provider, there's modules within Epic that have all that built in already. You can just add it to your workflows and collect it for every single patient. We don't want to just target certain patients, certain clinics, because that further stigmatizes it. We want to ask everyone.
Is there any guidance out there to help providers with these questions and how to implement them into their programs?
There's a lot of resources out there to help people figure out how to ask these questions of folks. There's a great campaign called Do Ask, Do Tell, kind of a spinoff of Don't Ask, Don't Tell, where it's a campaign around how do we get patients to disclose their sexual orientation and gender identity information. There's toolkits out there. It may seem daunting to undertake this, but I will say that in my work here at Penn Medicine, it's been one of the biggest accomplishments and things that I'm most proud of is to help transform our culture where asking about sexual orientation and gender identity and having patients be authentically who they are when they walk through our doors is really one of the biggest successes of my career so far.
Head to the show notes for more resources on supporting LGBTQ+ patients. Next time on Cancer Buzz, how your cancer program can build trust with marginalized groups to ensure equitable access to healthcare services. For the Cancer Buzz team, this is Summer Johnson.
Cancer Buzz is a resource of the Association of Community Cancer Centers.